Today we have an exciting episode. We've been really looking forward to for almost 2 months now. This is our first stream. We're having a guest on today, and really excited about this guest. Her name is Dr. Cirillo. She is a licensed therapist. She serves the Greater Hartford area around the South Windsor and Connecticut. So um, we're excited to have her on. In probably about 20 minutes she'll join. Um, but we're gonna have a conversation around insurance, health insurance in particular, um, and just kind of see where it goes. If you have any questions, please put it in the put it in the chat, put it in the comment section. I'm regularly in touch with her, so if we see your questions in the comment section or anything like that, we'll for sure I'll definitely ask her and we'll post a response if people see this on YouTube. But if you're in the stream, please do ask questions. We already have some questions prepared for her. Uh, to try to lead the conversation in a way where we can have a good flow, because she's not going to be here for a while. She's only going to be here for a short period of time, so we definitely want to just kind of get through some of the topics and then take it from there. But as always, I am your co-host Nav, and we have
Annette.
On week 8 of All the Factors.
All the Factors.
That's right. But after that, so after Dr. Cirillo comes, we will dive into like other afterthoughts.
Yeah, just gonna do a little debrief because I'm sure we'll have thoughts. Anybody who is joining who might be in the chat probably has some thoughts, all that sort of stuff. So yeah, we won't just kind of leave it hanging after the 20-25 minutes or so that she's on.
Right. So I don't want to give too much of an introduction to her. I'm just gonna let her kind of come in, introduce herself. But she's been doing this for a while, and she's really, and as you guys hear it, it's Annette's first time meeting her as well. I've known her for years now. So just she's just a great person overall. You'll hear it in her voice. She's very sweet, very nice. Somebody you can easily talk to, and you can easily imagine you sitting in her office and having these conversations with her.
I'm excited to talk about this topic, but I'm also really nervous to do this and talk to her. It is our first guest, so we're kind of still.
So maybe it's that.
We'll see how it goes, but I am excited. I think the topic is interesting.
Yeah.
Do we kind of want to talk about
Alpha Domingo? Thank you for the follow. Welcome. I'm sorry, I didn't mean to cut you. Go ahead.
No, sorry. Do we kind of want to talk about why we decided to go with talking to her about like her experience with the health insurance system rather than just like what it's like to be a therapist overall?
Why did we decide this? Is that what you're asking?
Yeah, like did we want to talk about that a little bit?
Like her being, I think we'll keep the like not really necessarily about her. I think we'll keep it towards like insurance. Just more towards that, like her what she really likes, because me and you are not. I think that's how I envisioned this. Or okay, maybe I'll just say I'll say how I envisioned this episode. Right, I envision it more of like I have no experience with insurance as somebody that takes insurance in any facet of life, right? And you do, and that was going to be one of my curveballs that I mentioned earlier. Is I was accused of running the show here. I was accused that I talk 80% of the time. So this episode, that is going to be, we're going to reverse that. Yeah, you're gonna lead this thing. So however you want this show to go,
no,
is how this show will go. So that's where we are. I'm gonna say this, and tell me if I'm right. And I feel like I'm right. When you saw the whole trend with the man and the bear in the woods, right? Who would you feel safer with?
Sure.
Yeah, you saw that on TikTok, right? Like when we're like, well, if you were to be stuck with a man or a bear, and a lot of women were picking the bear because they wouldn't feel safe with a man in the woods.
Yeah, I saw that.
Okay. My flex is that the women that know me personally would be feel safer with me than the bear. That's my personal flex, right? So I got accused of overstepping. We're gonna fix that. We're gonna remand that today.
I don't think you did it maliciously. I just think you're a little chatty.
I'm chatty.
You're just a little chatty Cathy.
You know what? I'm not saying a word the entire fucking stream. Every single every single episode of All the Factors from this day hence, from this day forward, will solely be run by Annette.
We're gonna change it. We're gonna change it to the Annette show.
This is just what it's gonna be. I'll be just another one of those guests.
All right. I'm gonna say I don't. I apologize. I didn't mean to come at you last week like that. It's really.
I've been thinking about it for a whole week.
I'm sorry. I'm still trying to find my groove kind of with this. I was projecting.
So it's not me. I just want everybody listening to know this. It was not my fault. It was not my fault. I will not be accused in this stream. I will not be accused of putting women down. That just will not happen. I will not stand for it. No. Reckon said, I think your passion just comes out different to hers. Yeah, I'm more passionate. That's just what it is. Nothing wrong with that. Okay. There's nothing wrong with having different levels of passion. It's just it's okay. Some people are dedicated to this, some people aren't. Hey, listen, and tell me if I'm wrong. How many years?
You didn't say that you were gonna come at me. This was an attack episode. This is. I thought.
How many years have I tried to get this going? How many years have I told you to go to law school, and then here we are. We're fucking podcasters. We're supposed to be lawyers.
I know.
And we're podcasters and streamers. God damn it.
We don't get paid for this.
Hey, I get subs. So, no. Please don't sub to me. Keep your money. I don't need it. I just appreciate you guys coming here.
It's interesting how you're apparently such a safe man, but here you go co-opting my idea. I'm pretty sure it was me originally who came.
Well, do you want safety or do you want equality?
We should do a politics podcast. I thought that was me, but that's okay.
But like I said, do you want safety or do you want equality? This is how I would act with another man. You're a protected class.
Well, good, because I treat you just like one of my little girlfriends.
So. Yeah, I don't like that. I just don't like that. No. Okay. We're gonna switch it up here.
Okay, so why are we talking about?
You tell me.
Health insurance.
You tell me.
Okay, so really since the election, we've had a lot of different current affairs. We don't have to get into the specifics. I think everybody knows what I'm talking about, but and it might sound a little bit outdated at this point, but suddenly, in the national conversation, whether on social media, in conversations, even with individual families, it seems like people are suddenly coming to light about the idea that our health insurance system, whether you believe that we should continue with the privatized system or whether you believe that we should have universal health care, it's like that meme with the hands coming together. Everybody is kind of in agreement that the system that we have, the health insurance system that we have right now, essentially where some supposed doctor who works within a health insurance system, but basically the health insurance company just gets to decide that you don't get to have the care that you need, that your personal doctor has said that you need, just because it doesn't fit their algorithm, what they want to spend money on. That's really what it comes to. We spent so much time on this podcast talking about, capitalism and how essentially if you just let these companies keep going and going and going, they're going to take and take and take. Yeah. And that's something that we're seeing in particular with the healthcare system here and health insurance in general.
Yeah,
I would say.
And just a kind of a tangent, but not really a tangent. But if your TikTok for you page looks anything like mine, I'm sure you guys seen that. And this problem, let's just say misuse, or just let's just say a problem that insurance companies have, right? Because it certainly is a problem. It's not just for health insurance companies. I think it applies to everything else too, or whether it's car insurance, um, house insurance, anything insurance, right? uh, if your page TikTok page looks like mine, I'm sure you guys seen that one video of this roofer on a roof trying to trying to get this insurance claim specialist to try to show him, like, hey, like, can you show me how I should be doing this? And the guy goes like, well, I'm not an expert. Then he's like, well, how can you decide then, like, how I'm an expert? I put
Right.
roofs up for 40 years, you know what I mean? I know that this roof needs to be repaired. And he goes, well, no, you just you know what I mean? Like, so if you don't know how to put a roof on, but yet you're sitting and deciding how an actual expert, aka roofer, or a actual doctor, or how
Well,
they should do their job, then like where that's a problem, I think.
that's the thing. I mean, that's a major problem, and
Right.
I mean, compounded with that, I mean, something that did come out of, um, the CEO murder, that whole conversation that kind of erupted out of it is that, United Healthcare was utilizing an AI
Right.
to determine whether or not a claim should be approved or not, and nobody was checking that AI. It was just what if the AI says yes, it's approved. If the AI says no, it's not approved. And I mean, that's a whole different conversation, but we're not at the point where AI can just be going and doing things unchecked yet.
Right.
It was just, I mean, I don't remember the exact statistic, but it was denying, like the amount that it denied was just overwhelming.
Wasn't it like
As
80%?
opposed something like that. I
Yeah, some
think that might
insane
be
number.
right.
Yeah.
Like, so, and I mean, I don't even know if the media or anything ever kind of got to the
Like, just to
details as
talk
to
about
what
that.
made it
Yeah.
approve
Yeah.
the little
Yeah.
that it did. I mean, I don't know if it had to be extreme or if it was just that it was cheap that it made it approve it.
Yeah. Yeah, no, I think
So
it's insane. So like I think that's exactly it. And I think for this stream, when Dr. Cirillo joins us, um that's kind of what I want to ask her, right? Like, what is what is her experience? Like, how does she deal with when she's had a session with a client, and that gets denied? And a lot of times, from the conversation that me and her have had, it happens months afterwards, right? Like, she thinks it's all hunky dory, the client thinks it's all hunky dory, then boom, like, oh, yep, well, we're not going to cover that, and it's been like 3 months, right? Like, so now you got to have this conversation with the client, like, hey, your session didn't get covered, now you have to come back and pay for it.
right, and at that point, I mean, how much has been accrued because they didn't know? I
Right.
mean, they probably can't afford it just straight up out of pocket. Otherwise, why would they be
Exactly.
dealing with their insurance at all? If you suddenly go to your therapist and you have an $800 bill because because you're being charged for the last like 5 sessions,
Yeah.
then I mean
And that could just add
that's
up in a
totally
month,
unacceptable,
because
right?
most people see it
Yeah,
once a week, right?
that's true. That's true. I mean, I was being like generous when saying you go like once a month, but I mean that's not
Yeah.
even really helpful for people.
No, that's not realistic at all. I think most people do go once a month, depending on the severity of your issues. But anyways, so we'll have that conversation with her, how she feels about it, how she deals with it, and if there's anything that she actually likes about the healthcare system that we have today. Um,
Yeah, I would be interested to know what they're doing right, if
right,
anything.
right. We wanna try to. I'm gonna choke blood saying this. Give the benefit of the doubt to the health insurance companies. We're we're gonna we're gonna
Where's the
we're definitely
commenter
gonna.
coming out saying that we have the best healthcare ever, and it's because of the privatized companies and
Right,
that
right. Have
those
you seen the
CEOs
wait times in Canada? You gotta wait a whole day.
those CEOs
But are you
deserve
broke afterwards?
$50 million a year. Yeah,
But are you broke afterwards? Can you feed your family after?
right.
Uh, there's that. And I think that we can have a conversation about that too, because a lot of that, yeah, when you have a healthcare system like, for example, Canada's, yes, you do have to wait a long time because you just do, right? Like, because it's so many people can readily go see a doctor. They don't have to think twice about it. If anything goes wrong, if they even feel off, they can go see a doctor, right? So that means more influx of patients going in. Uh, but that's not because it's a publicly funded system. It's because it's a poorly publicly funded system, right? It's about funding at that point, right? Like, more funding needs to go in. You need to train more doctors. You need to have more facilities to be able to readily available for. Imagine, like, what if there was a town of like 2,000, 3,000 people, or like how it and this kind of just occurred to me. So in Connecticut, in the state of Connecticut, liquor stores are determined by how many people are in per town. If the population of that town increases, then more licenses for liquor stores are available in that town. What if healthcare system worked like that? Per 5,000 people, there was a clinic for a doctor, right?
Okay, but I
Just
guess
an
I
odd
don't
number
really
like that.
understand this line of argument because I mean, are you saying that our like single payer system is cutting down on the amount of people like going to the doctor, so that's why it's more efficient? Meaning, like, there's a whole sector of people who can't afford to go, so they just don't. They just die.
I mean,
Like, is that the
but
alternative?
is that not what it is right now? Like, people just can't afford to
Right,
go,
but
so they
how does
just don't
that?
go.
How can you use that argument to say that
That
our
that's
system
better.
is more efficient? We have more people like I mean, and then those deaths like aren't going into any sort of like database, right? Because they're just dying on their couches of things that nobody knows.
Yeah, and you know what this classical case of it is, right? It's the grass is greener on the other side.
Right. I mean, I just don't. I especially like
It's people
if
with
this
money
was
thinking
like
like, well, I can afford to go if it was paid. If it was
well,
private,
sure.
I'll just go
Well,
there.
sure. I mean, it's that very kind of selfish mentality,
Right.
like as if we don't all have to live in a society.
Right.
It's like that same argument, but I just don't really, I guess I don't really understand. I don't have a ton of knowledge on the Canadian specifically like healthcare
Right.
system, but
No, but I think that's the biggest
some
thing,
of
though,
the,
right? Is like, oh, I have to wait too
some,
long. Yes,
I
yes, yes, yes,
guess,
yes. Go ahead.
but I just feel like that's almost like an outdated argument. I mean, especially if you're comparing it to the United States and you're saying that that's why our system is better. When I mean, if I got diagnosed with cancer today, I still probably wouldn't get treatment for 3 to 6 months. So it's
Yeah.
like, is our system like all our system seems to be doing is making people broke?
Right.
On
Like,
top
and then
of
like
being slow, on top of being, inefficient.
one pill for that cancer treatment is probably gonna be like $50,000. You know what I mean? So it's like, was it really just better?
Mm-hmm.
No, it wasn't. No, it wasn't. No, it
And I
isn't.
mean, I'm talking about this as somebody who I don't, again, not healthcare expert. I mean, I've mentioned I do work in a capacity where like the company that I work for does manage some like Medicaid funding. But I guess kind of to speak on that, hopefully this isn't too much of a side tangent, but
No.
I feel like the company that I work for, like just inherently in being public in that way, we're dealing with public dollars. We care more about the people that we're working with. And my justification for that is that we have people I mean, like people like me, like my whole job is to see if the programs that we're implementing for people are working, are improving outcomes, not just to, I mean, yes, to save taxpayer dollars, but also just for the sake of improving outcomes. There's also people that I work with that are all like, we go out and we get grants and they provide services for people experiencing homelessness, people, just experiencing these food insecurity, all these different things.
Yeah.
Whereas I don't, if you see that from a private company, I would say it's probably minuscule. And it's probably done for a tax write off, not to get too cynical, but like, that's what my
No.
thinking on it would be.
No, I think we just want to be real. Like, I don't think it has anything to do with being cynical. I think it's just what is the fact. Anyways, I just gotta. Sorry, I don't want to like get away from this point. Uh, Dr. Sorola just texted me. I think she will be joining us soon.
Okay.
She said, "I'm ready to call into the audio to join if you're ready." I said, "Yeah, whenever you're ready." So any minute, she should be just here. But but yeah. So like I said, if anybody new's joined us, whenever she gets in here, we have some questions. Annette will be our main host today, and we're gonna kind of let her give her background, and just kind of explain what she's done. I want to say, I think, what's that? What's the university in New Orleans? Tulane.
Tulane.
Tulane. I think that's where she did her practice, or her doctorate.
Okay.
So she is very knowledgeable, very nice person. Hopefully she can join us soon.
I'm glad we were able to make the timing work. So I hope I didn't miss too much of tonight's intro, but
no,
definitely not.
Perfect timing. Also, okay, Robin, I was accused of not letting Annette talk, so I just want to let you know that she'll be doing a lot of the talking.
No,
I'm sure you're familiar. You're familiar with the statistic that men think they speak less than women, but they actually talk way more.
Yes.
That's the accusation that I levied last week, and apparently it did hurt his feelings a little bit.
I need another guy in here. I just need another guy in here. Anyway, so I'll do a quick. I haven't told them a lot about you. Okay. I was gonna kind of just let you do whatever you feel comfortable with, because we are so happy to have you as our first guy. I literally, honestly, could not think of anybody better. So everybody,
so nice.
Dr. Robin Cirillo will take the mic and tell you a little bit about her. We have some questions, and we'll ask. But if you have any questions, please type them, and we'll ask her for sure.
Okay, so did you want me to say a little bit about my background?
Yeah. Whatever you feel. Maybe where you studied, what you've been doing.
Sure. So I am a licensed psychologist in Connecticut, and I've been in practice since 2002. During my training and graduate years, I got my doctorate from the University of Connecticut, and I did my master's degree at Columbia University in New York City. Before that, I also studied with some of the best doctors in infant mental health, which is an very interesting field at Tulane University in New Orleans, and that
sounds really interesting.
It is, because people often don't consider doing psychological work with children under the age of 3 because of the difficulty with language and communication, but there is a whole field that has been studied and kind of founded by Dr. Charles Zena, and he was originally at Brown University and continued his career at Tulane Medical School, and he's a phenomenal professor and teacher and expert in infant mental health. And so I did training under that team of people during in 2001 to 2002 for part of my internship year, which is part of the graduate program to finish your doctorate, and it was phenomenal. So really interested in working with children and families, and at that time it was around making sure parents who had possibly been at risk of losing custody of their children, but they wanted to reunite, were doing the work to become safe parents and be able to work with the team of mental health providers and other staff and professionals to make sure that they were ready to have their children rejoin their families, and had done the work to prove that. And it was fascinating and really rewarding. So that was my background. But here in Connecticut, I don't work with kids that young anymore, because it's extremely specialized, and Connecticut doesn't identify kids in terms of coming to outpatient therapy that young. So my youngest kids that I work with here are probably, I would say the youngest is 4 years old, and then it goes up from there. And, I work with teens too, as well, middle school and high school, and up through college age. So that's kind of a little bit about my practice. I'm in South Windsor, Connecticut, and love the work I do, and do most of my week with clinical hours and one-on-one or family sessions, which is most of my if you were going to say, how do I spend most of my week, it's that piece versus the administrative side. Some people who are in charge of practices do a lot of admin, but I definitely do more of the clinical work. So
okay, that's great.
Yeah.
Thank you so much
guys,
for sharing all that. Oh.
Yeah, no, I'm sorry, I didn't mean to cut you off. But definitely not a paid actor. I actually bought somebody that's actually very knowledgeable.
Oh my God.
So yeah.
So yes, anyways, I'm happy to answer any questions I can for people. And I am a small practice, so I have friends and colleagues that work at agencies or work for larger practices. One of my friends who I went to grad school with, she lives in California. She did her training out in California at the end of graduate school for internship and her postdoc, and she opened a practice in the Palo Alto, Northern California area. She's phenomenal, very skilled, but she, like what I was just saying, she has a small caseload. She sees a handful of clients per week, but she also runs that extremely large practice. I think there's over 60 clinicians that work for her.
Oh, wow.
So that's like huge. That's a big practice. She's doing great, but she does a lot of the admin work. Whereas on my end, I have people I subcontract who are part of my monthly. They're not part of my staff, but I hire them and pay them I guess you'd call it a 1099 to do my things like my billing for insurance companies, my bookkeeping. I have a billing manager. I don't actually do the billing, but so anyway, so I can get into more of that, but.
Yeah, I think me and Annette were kind of talking like for like today's conversation and like the conversation in that was in the news, how fast it moves, like it kind of goes away like in split seconds. We really wanted to get an understanding of like how does insurance work for small practices? When you're a solo practice, like how. I'm sure the news, the national media has already covered like how it works for hospitals and stuff like that, or like ERs and stuff. But I feel like the mental health profession just kind of gets like always like pushed under the rug. Like nobody ever talks about like how that is being dealt with. So we kind of wanted to keep that conversation towards like how is insurance in the mental health field? Is it different? Is it the same? Does it work the same way? Kind of those, and and whatever you want to share is totally fine.
Sure. Yes.
Do you want to do the first question?
Okay.
I'm sorry. Go ahead, Robin.
No, that's fine. And you can go ahead. Yeah.
Sure. I mean, he really touched on it, but I guess just to put it in a nice little bow, as Nav mentioned, kind of talk about health insurance has been a little bit more in just like on social media, kind of a little bit more relevant recently. I think a lot of people are kind of engaging in it a little more. So we just wanted to kind of, if you could just give us just your overall experience about working with the health insurance system as you're trying to provide clinical services to your clients, that would be great.
Sure. So when you're in a private practice, such as the one I run right here, you can, as a provider, when you're starting out, you can choose to take insurances as accepted forms of payment, be contracted with those insurance companies or not. There's a whole entire process to get started. So when a person first becomes licensed as a mental health provider, and I can really only speak to Connecticut, but that could be any licensed mental health provider, not just a clinical psychologist, which is doctoral level, but also licensed. For example, you've probably heard of a licensed clinical social worker. That's an LCSW. That's a licensed designation. A licensed marriage and family therapist, another licensed mental health professional. An LPC is a licensed professional counselor. All of those different master's level therapists, because they became licensed in the state of Connecticut, they can go ahead and apply to accept insurance as payments instead of just out of pocket. So if you choose to do that, there's a whole method of getting credentialed so that the insurance companies know your background, your education, where you've worked. It's almost like putting together a whole resume, and they can vet you, and then they can decide if they're going to offer you to be paneled under their contracted insurance company. So, for example, a major insurance in Connecticut is Anthem Blue Cross Blue Shield. So, if as a provider I take Anthem Blue Cross Blue Shield, that is one of the ones I applied to when I first became licensed, and I got accepted onto the panel. And because of that, I work when I see a client who has Anthem as their insurance, I'm contracted to their terms. So these are things like their rates. For example, the rates that they reimburse the provider at, depending on the session code, you've agreed to those rates. So that's one of the big markers of why sometimes mental health providers feel it's difficult with the insurance companies, because the rates are not consistent across the board. So with one insurance company might have, let's just use an easy number, $100 as their reimbursement rate for an individual meeting. Another insurance company might have $60. And so what that means is if you agree to all the different insurances, which is completely fine, but you're signing up for a really varied hourly rate as a provider if your week is made up of clients with all different types of insurance. And so someone could have, like, you've heard of Connecticut is one of the main Connecticut ones, or Cigna, or United Healthcare, or the state insurance is called Husky here. And so all of those different insurances reimburse the same individual session at a different rate, that they have done their own market research, that they decide what they're willing to pay depending on the therapist's level of training. So master's level versus doctorate level, and they give their rate, and because you agree to their contract, that's what you're agreeing to. And those rates might stay kind of fixed over a period of time, or eventually some of the insurances annually will do a review, and sometimes you get you don't even really know, unless you're really keeping up with all the paperwork, that you get something back in a new year and the rate goes up, and as a provider, you might say, oh, well, wow, I'm getting a higher rate from the same insurance company, but they hadn't increased their rates in 5 years, but they must have done a rate review. And in this part of the country, they've agreed to a higher rate for this session code. So one of the reasons people back in the 90s and the early 2000s, some providers started saying, I'm not doing that anymore. First of all, they thought the insurance companies weren't paying enough. The insurance companies were paying too little, and they had so much paperwork and red tape and having to go through so many hoops to get a claim paid out, that they said, I'm not going to take insurance. I'm going to just go fee for service. I'm going to set up my practice, and I'm going to tell people if they want to see me and get on my calendar, it's $150 a session for a 50-minute session, cash, check, or credit card or whatever. But they're not going to don't even take your insurance out of your pocket. Like, they're not taking a copy of your card. They're working fee for service. Now, for me, I never wanted to do that, because that's not, I find it's not why I got into becoming a psychologist.
Absolutely.
Yes, I enjoy, like, clients from all different backgrounds with all different types of insurances, and cases that come with those different types of insurances, because there's different types of presenting cases you get with different insurances, believe it or not. And I find that the most wonderful, fascinating part of our work. I don't want a set of my population of clients to only be people who can afford $150 an hour, 3 or 4 times a month. That's right. That's not what I wanted. So anyway, I ended up accepting. I accept quite a bit of the different insurance panels. I'm a provider in network for I would say maybe like probably 5 or 6 of the major ones at this point. And over the years, I've added more to my acceptance of, I've added more. Like I started out with just a couple because I was so new. I was just starting. I started with Anthem, Blue Cross Blue Shield, and Aetna, because many people in Connecticut had those insurances in the early 2000s. They still do. And then over the years, I added different ones. I added Husky, I added United Healthcare, and I've added the military. The military one, I'm pretty sure I'm in network for the military when I see a couple of military families. And I think I'm considered in network for them too, which is TRICARE. So it's been, a journey, but I definitely, I like taking insurance because as a person in the community, when I go to a doctor, I like to use my insurance,
Right, for sure.
Yeah.
I'm always happy when someone says they take my insurance in network. So I feel the same way as a doctor to provide us the service I provide. I try to do the same that I would like as a consumer to have my insurance accepted. With that comes a large headache in many ways.
Yeah.
Becoming, because I accept all those insurances, not all of them, but many of them. I have a person that I have to, she's amazing. She's my billing manager. She is an expert in billing and does all of my billing for me or anyone who has ever worked at my practice. And I don't know what we would do without her, because she basically knows. She's does all of her billing, and her business is for mental health providers. So either psychologists or any of those master's level therapists I mentioned, or psychiatrists. She does exclusively mental health, and she's an expert. So what's good about that is when things go wrong or fall through the cracks or claims get denied or the insurances make errors, which they do, as a solo practice owner, I would have a very hard time keeping up with that amount of paperwork. It would be another full-time job after hours, to see what sessions in the last month got paid and what sessions got denied and why, and how do we have to resubmit them? Were they missing was there an ID number that was missing? Was it a duplicate? Was it an error on the insurance's part? So she has to track all that down at the end of each month. And that's when I'm just one person doing the practice, but I've had it in the past, I've had 5 to 6 people working here at any given point. I'm much smaller now after COVID, but in the previous years, I did have a bigger practice, and that's an immense amount of work. And I'm just one of her clients,
Yeah.
So if you think she works for many different providers, I'm just one of them, so yeah.
No, I'm sure that's a huge time suck. And if you had to be managing that all on your own, I mean, I can only imagine how much that would cut into the time you're able to actually dedicate to your clients themselves.
Exactly. Right. That's exactly right. That's exactly why I outsourced that. And I give Kim so much credit. And, the bill can get expensive, but it's worth it because I trust her. She's excellent at her job, and she does try to track down if there's a problem. What happened? Is there anything I need to do? Sometimes I have to send a note in with something that got didn't get correctly processed, and I have to send a little note on a cover letter on my letterhead. So but she'll let me know, here's what you need to do, fax it over to this person, and they'll resubmit. Yeah.
So like what I'm thinking about, and like as you're talking about this, is like why do you some sessions get denied? Like what are the insurance companies thinking? Like, oh, like this doctor is just like sending us like fake stuff. Like obviously that, like I'm sure some of that happens, like, but I feel like that's got to be a rare thing. So like, what reason do these insurance, like, why do they deny some of these claims, especially like mental health claims or anything like that?
Yeah. It's extremely confusing because when you read one of these, they're called EOBs, or explanation of benefits. When we get these, I get these once a week, and and many of the claims will be paid, but then some will be, it has columns that you read across, and at the end it will say like what Anthem will pay, or whatever insurance company it is will pay, and it might say $0 for that date and that person. And then you have to look at these codes, and they're numbered codes where at the back there's almost like, at the back of this stack of papers there's a glossary, and the glossary will say, what does 002 mean? And it might mean, if you read across, okay, 002 means it's a duplicate claim. Those to me are the most straightforward. It means my billing person, for some reason, she submitted it twice. That's what they're saying. We already saw this claim, we paid this claim, and this is the second time you're submitting it. This date for this person's been paid, so we're not paying the second one. That makes perfect sense. That happens occasionally. And then there's other reasons that you read through, and it's confusing, because sometimes it'll say something like, this person's plan has been terminated. This is an example of something that happens more often, where if you look at the person's name and why it was denied, the code says this person's plan is terminated. They don't have this policy anymore. That's not true. Like, I work with the person and their family. They have had the same job for 15 years. They've had the same insurance. Their insurance has not changed. Their ID numbers have not changed. I don't know if that's a glitch in the system, but what it is a lot of extra work for us, because then what I have to do is call my client and say, am I missing something? Did you change your insurance? Did your job change your insurance? Did you not tell me, like, the person who holds the insurance in the family changed work or changed? And they often say, no, we have the problem. We have the exact same plan that we've had since I've known you, and the same ID number, and everything's exactly the same. What are you talking about? Then they get worried. Why are my claims getting denied? And I say, okay, no, that's okay. Let me circle back with my billing manager, and she has to resubmit the claim. And then sometimes she has to call the representative and say, that's an error. This person, look it up on your end. They have that policy. They have the same name, the same address, the same insurance that they've had from 5 to 10 years going back. Nothing's changed. So why are these claims in the last month or two getting denied, saying that their policy's been terminated? Like, it's literally an error,
Yeah.
Right. And that whole time sorry.
Yeah, go ahead. Sorry.
I was just going to say, that whole time, I mean, you already had to speak to the clients. They're just sitting there stressed out, just thinking that.
Yeah, it does it, thinking have they lost their insurance? And, I've had people who, the family, it's not just me as their mental health provider, but I had a family come in, it was probably in November, and the mom was extremely anxious. Here I am treating her for being anxious anyway, but now she's telling her family claims are being denied in the medical. So she has children, and their medical claims are being denied, and there's something going on with the insurance, and her husband's job has been the same, and she doesn't know, and she's in touch with his HR person, and she's like trying. She tells me this really did happen, where she said, I have to not book with you because I'm so anxious. All these bills are coming in the mail, these medical bills, and I'm afraid yours are coming next. Like, what if these are all getting denied, and now I'm behind by a month? I can't afford it. It was right before Christmas. I said, I understand. I don't want you to add me to your list of worries. Like, we'll figure this out. And, I said, I want to be here to support you, and I don't want our meetings to be all about your anxiety about your insurance bill. You know what I mean?
Yeah.
Well, right. So, I mean, at that point, it kind of stops being helpful, right? Yeah. I mean, if you're just focusing on insurance issues.
I know. And I'm like, oh my gosh, that was just like that was like the tip of the iceberg. We had so many other things to discuss, but she's just thinking, is this session going to be out of pocket? I can't do it. So we figured, luckily, just to let you know, that case did get resolved. They had, the insurance again had made a mistake in one letter was different or something. One letter on this very long ID number with letters on it, and it got corrected and everything got resubmitted. And luckily that the mom of that particular family was very much on top of it and was able to get it all fixed. But it was so stressful for her.
Yeah. Now, would you? And me and Annette kind of like mentioned it, and it's not like we're not coming up with this like new thing, and it's kind of been in the news too, especially with the whole United Healthcare thing, and it came out like the United Healthcare was using an AI that was denying people's claim by like some astronomical number, like 80%. Would you say like this claim denials like started happening a lot more in the last like 2 or 3 years, or like would you see there's like increase because of this?
Personally, I have not seen that, but just to circle around that is that just so you know, when I do my work and I submit my day sheets to my billing manager and cross check things and get the mail and quickly just go through it at a glance, that's exactly what I'm doing. Like I don't go through it with a fine tooth comb because that's what I pay her to do because I don't have time to do that.
Yeah.
If I see something glaring, there's times where I have a case where they'll start denying claims or almost retracting previously paid claims. And again, it's one of those scenarios where I know the family, I know the parents' jobs haven't changed, their insurance hasn't changed, and all of a sudden an insurance company is taking back 6 months of paid out claims and they're taking it back from me.
Jesus, 6 months.
They won't even like give you an option. They'll just take it off of. It's very bizarre how they do it because they'll do it because they're not paying that person's claims anymore. They just start taking it off of what they would have paid you for any of these other families. They just subtract it.
That's insane.
It's pretty crazy. And there's literally nothing you can do about it except have a person like an expert, like my billing manager, call and get on the phone with someone who can correct it if it's a problem, which I would say 9 times out of 10, it was an error and they fixed it. So it was okay. There's only been probably one time where, for example, the person's parents did change jobs and that insurance was really not effective anymore. And they never told me, and they never mentioned their parents because maybe they're like in college that, oh, my mom changed jobs or something. So then I just keep billing to their regular insurance, because that's what we do.
Yeah.
And then the insurance doesn't catch it and they're paying. And then they realize, hey, wait, this person hasn't had our plan in 3 months. Like we're taking all that money back. And then I say, oh my gosh, did your parents change jobs? Oh, I forgot to tell you they did. Oh no.
Which is like an honest mistake.
Yeah, it's an honest mistake. Right. And it's unfortunate, but then we try to get their corrected insurance and try to see if we can backdate. Some insurance companies will let you backdate those meetings. You have to provide all the paperwork that you had submitted it to the other one initially, not knowing it had changed, all of that. So but and sometimes it goes through and sometimes things fall through the cracks and you lose that, you don't get stuff back. And so there's been so many different issues with that, but I haven't seen a drop. What you're saying about this AI business recently in the last 1 or 2 years, I haven't seen a drop like that. To me, it's been a consistent kind of since I began in 2002, so 22 years. It's been kind of a consistent headache. Like it's like this thing that never goes away, but it's also like a necessary evil. Like you as a provider, again, I want a large range of clients. I want people to be able to use their benefits. So I take a lot of different insurances and I agree to that headache. I mean, I have had colleagues who began as taking insurance and they eventually gave all of their clients a few months notice, maybe 3 or 4 months, that they were coming to a point in their career where they were no longer going to accept insurance after a certain date, a few months out. Gave them time to, do you want to stay with me? I can refer you elsewhere. Just deciding I'm not doing this anymore. And so I could have done that way back in the beginning. I could have done that at any point. I still could do that. I don't want to do that, So
yeah,
so
it would only make your life easier to do that.
It would make my life easier. I wouldn't need Kim, and even though I love her, I wouldn't need to pay that large monthly bill. I would never have mail coming in that had rejected claims or that would have money being taken back. All of those things. You get audited, you have to provide summaries, which is very awkward in mental health because they sometimes request the charts and notes from a third party review, which I always have a problem with. I'm like, who's reading? I'm not sending you my notes. Yeah. Let's just get that out there right now. I'm not sending those. So I can do a paragraph. I can do a summary. It's going to be extremely vague. And that's all you're getting. I'll give you my session dates, a diagnosis, which I don't even want to do. And then that's it, like a paragraph of progress. Because why do you need this? This is why? Who's reviewing it and why? If I don't send it, though, they're going to start denying claims. Like it's so frustrating. It's because you have to do it. Your hands are tied. If you don't do it, they could definitely start denying claims,
Yeah, that like just sounds to me like such a big HIPAA violation. I don't know, like that's just what it screams to me. Like who is this unqualified person? Like what? Like you know what I mean? Like I totally understand. Like your hands are tied. Like what do you? Yeah, like what are you not going to get paid for your work?
It's very frustrating. When we started getting those, my partner retired during COVID. He was my undergraduate advisor. Dr. Jack Chinsky is phenomenal. He's retired, during probably it was at the end of 2020 he retired. And so, but anyway, when we began together in 2002, we didn't get those in the beginning because I was taking insurance for a few years before one of these third-party auditors sent a letter, and we both thought it was a mistake. We're like, we would sit down as colleagues in a staff meeting going, what is this? Is this like some sort of scam? Like I'm not sending my notes to this. Who is this? And so we turned out, after a lot of research and talking to people in the community, other providers, it was not a mistake. And if you don't send your report, you might not get paid. So I remember having a big fuss in the beginning over it, talking to other providers, talking to the companies, the insurance companies, saying, I think it's a violation. Why am I sending details of my work to who,
Right.
And I'm not going to do details. So they accepted my format and our format here at my practice, where we give them what they need, which is basically an overview, session dates, a couple sentences, very vague, and that's what they accepted that and moved forward. But I still get those. It's the interesting part is those were almost like in fashion for about 10 years. And then I want to knock on wood here. They kind of have they've reduced. They haven't sent as many of those probably since COVID, maybe because the mental health need for providers skyrocketed since COVID. And so I don't know if they're just letting it was almost like they stopped being so scrutinizing the claims so much, maybe. But I don't know. I mean, those could come back around, those third-party audits. We do get denials, like I said, but I don't think they're more, in my point of view, they're not, the denials in mental health at least in Connecticut or at my practice, they're not more than they were 2 or 3 years ago when this AI has kind of come into play. I haven't noticed that.
No, I just wanted to just to see if that had any correlation, because that's what's been coming out of the news. That's what
and that could be the case. And I who my billing person might be a better person to ask about that, because she like I said, she does the billing for numerous mental health providers, not just me. She probably, I don't know how many people she bills for, but she would be the best to say if she noticed a big increase in denials in the last couple years. She would be a good contact to ask about that.
No, for sure.
It sounds like they don't even need that, considering they're so good at denying claims just due to clerical errors on their own end.
I know there are clerical there, and I'm always surprised. Like, I try to get through a whole EOB and think, explanation of benefits. This is going to be okay. We're good. We're going strong. I see they're paying them. They look good. They paid, and then you get to this page or two of zeros, and you just think, well, I spoke too soon, because it could be like a 15-page batched EOB, and you think like, okay, it's on a roll, it's going good. And again, some may be legitimate denials, a duplicate claim, an incorrect ID number, but then some of them are not. This just happened this week. This is so strange to me. Like, this, because it's the new year. In this week alone, I got 2 pieces of mail with my practice name on it and my address, with therapists. When I opened them, because they were to my practice, the therapist on there and the patient and the date and of the claim was from a therapist that have not worked at my practice for 5 to 10 years. 2 different ones.
Oh my God.
2 different ones. Two different therapists and 2 different insurance companies. So I had to tell both of those people, who I luckily am still, extremely friendly with and in touch with. I had to text them and say, hey, I got a piece of mail today. After you haven't worked here in 8 years, the claim is from 2 weeks ago from their own private practice. And it's somehow in 2025, the company, maybe it's a glitch in their system, the year renewed, and they attach that person back to my practice. So they have to call. One woman said that. She goes, every couple years, this keeps happening. This company, I have told them I don't work there like 5 times.
So frustrating.
Yeah,
it's almost like we've made a mistake, but you must pay for this. You know what I mean? Like,
exactly.
It is interesting, and I'm also like, I'm opening mail that's not mine. It's a problem. I say, like, I can put it. I will seal it and put it back in the mail to your correct address. And they say, you know what, like, they're handling it with the insurance. It was the insurance's error. It had your name on it. So it had my practice name. So it's all very confusing. And then I end up shredding it or sending it on to them, So it's bizarre, because I'm like, how, it's not even like they just left my practice. It was like years ago.
That is definitely bizarre. I mean, from all that you've said, I mean, all credit to Kim and all that she does, but it sounds like between, calling your clients about, these insurance issues, between doing these audits, all these things, it does sound like it's taking, if you compile it, it's probably taking a lot of your time that I'm sure you have a million better ways that you would, allocate it, right?
100%. That's where I sometimes wonder about my colleagues who went the route of doing fee for service, several years ago. And when they took that plunge and they said, you should do it. You should think about it. And I was like, I know. I sometimes wonder what nights when I'm staying late to go through paperwork like that, or to figure out an issue with my billing manager, like, why is this happening? And to pour over the ID numbers and to see where we went wrong, or where they went wrong, because it could be either direction, but it's often on their end. So it's like, I wonder why. Imagine if I did go fee for service. Some of these people that did that, they work half as many hours as me, and they probably have the same salary as me. You know what I mean?
Well, sure, because you don't have as much control over how much you're getting reimbursed, right? When it works perfectly.
Yeah, so. Exactly. It's like I understand why they did it, and I think they just had a certain vision of how they wanted their lifestyle to be, plus their work hours, their work family balance. And I was thinking more about like the type of practice I run, not where where I was like, yes, that would be nice, but I know I would not see so many people that I've just loved working with and helping their families and their kids, that it would not have been possible, so.
It's just unfortunate that you and, all other providers like you are kind of forced into a corner to choose that, when you could potentially, if you had more freedom in the system, you could have both.
Right. Yes, that would be, it would be nice. And I do think the rates are, they're kind of arbitrary to me because they're not across the board. They're not at all the same. And so it's a really weird thing when you think about like people who work X number of hours a week or have a salary, you know, and they know what they're getting every 2 weeks or whatever. That's like not at all how it is for my line of work, because sometimes I have more people in my cases that are with an insurance that reimburses better. And that's for a couple weeks. And then sometimes I have the opposite where I'm like with some of the lower reimbursement rate companies, and that all comes down to the bottom line at the end of a 2 week period or a month period when you're looking at your deposits. It's not consistent. It's not consistent. So I mean, that's tough for me because it's hard to manage when you're you have a family and you're like, my paycheck is not the same every 2 weeks. It's I base it on the how it looks in the account based on the previous month. You know what I mean? Mm-hmm. So that's unusual for a middle-aged person.
Yeah. And, you know, I like the I feel like the underlying thing too is like we can see the bigger impact on society if we were just looking at like people still need help no matter what. Like people need help out there, but if more and more therapists keep going the route of, you know, I'm only going to take cash or just not straight up like just not going to take any insurance, the people that are going to get affected most by this, and you said it, is lower income, so lower socioeconomic status people, right?
The poorest people, yeah.
The poorest people, and that's just what happens. Like I feel like this system just and Robin, you know my politics. I feel like everybody should have, you know, free, like everybody should be able to see you whenever they want. And I understand, like I don't think that's a crazy thing to have. You know, people like if we're gonna have this system of private, you know, pay for my healthcare system, then like if I'm paying for it, then I never should get denied for it, right? Like it's not like you go to a grocery store and be like, yeah, I'm gonna pay for these groceries, and the grocery goes like, well, my manager says you can only have you know 50% of the stuff. Like I'm paying for it, then I should be able to see you, and you shouldn't have to go through all this headache. I feel like that's just a like not a controversial thing to say, right? Like I don't know. I don't want to bring too much politics into this, but like from this entire conversation, like all that he explained today, in the back of my head, I'm just going like, that's really shitty that you have to deal with this. You know what I mean? Like it's just insane.
It is. It's like it's one of those things where I can't imagine not taking insurance, but taking it is such a nightmare. You know what I mean?
Yeah.
But I can't even imagine not doing it. I would never not do it because I put myself in the shoes of the clients that come to me, and I would want the same to bring my kids to a provider and hope that the bulk of the meeting or the service is covered by my insurance, and I have a copay or something, you know. And that's what it's like such a conflicting thing because I'm in both positions. Like I would love for it not to be the way it is, but I can't even imagine it being any other way. I imagine I'll take insurance for the remainder of my career, you know.
Yeah. So. Like imagine how shitty it is, like a mom that goes to see a therapist because, you know, her kid isn't feeling correct. Like just use a serious example, like maybe they have some suicidal ideation, they're fearing for their child's life, they go to a therapist, like, yeah, I can't help you, you know what I mean? It's like it must feel horrible for the mom, and it must feel horrible for you, be like, hey, this person right in front of me, right in front of my eyes, needs help and I can't help them. Like, you know, like that's just a crazy system we have.
I know I have people calling every week saying they can't get anyone to see their kids because everyone is oversaturated. They're booked out for months. Some of them don't take their insurances. Some of them do. The ones that do have no openings. It's such a difficult time because there's such a massive need. But even with a large influx of providers, it's still not enough, you
Yeah.
know?
Yeah.
Mm-hmm.
All right, we've talked a lot about like the bad, and I'm sure I can have you here every single day and it would not end. But is there something that you do like of the system that we have right now? I'm sure it's like few and very
Of the
few
insurance, I mean,
things.
well, I do like that. Like, I guess that goes back to what I'm saying, that I like being able to kind of take on a case where the people definitely can't go out of pocket, and I love that when I meet a new person and I know I can help them with their mental health issues that they're presenting with, and I'm so confident in the work we're going to do and that we're starting to do, and they have insurance, so it's like, just give me the card, I'm sending it on to Kim, and let's sit down and let's get down to business to get you in a better place because they're suffering. That's what I love about it, because that same person, if I didn't take insurance, would be picking up the phone to call the next person on the list. They can't go out of pocket, So
Yeah.
so when you say, like, what do I like about it? I like that part. I do. That's what keeps me taking it, because I'll hear the voice of a parent on the phone and being like so stressed out, and if I have the occasional opening, I'm booked and booked and booked out for months. Occasionally I get a weird opening in the middle of the day, and for example, it might be a college kid that's home on break that is then taking remote classes, so their schedule is flexible, so they can come in at 11 o'clock on a Tuesday or something, and I can take them and they can drive themselves here, and like everything, all the stars align, and then I'm really, when I sit down with them and I can see that I'm helping them get through to the other side of feeling like hopeful and back to their, healthy self. It's just extremely rewarding,
No,
Yeah, it sounds like it. And I think it's really commendable that you've kind of stuck to your principles in that, and that you've rolled with the punches that the health insurance behemoth has bestowed on you.
Thank you so much. Yes.
That being said, and like Mom said, we don't want to hold you hostage. We know you probably have to move on today.
Great. No problem. Thank you for having me. Yes.
Yeah, no problem. But just kind of to wrap up, I just kind of wanted to give you the opportunity to kind of, if just say just what you would like to see and see change. Like, what changes would you like to see from these health insurance companies and how they're providing mental health services? And in that, if you, you sound like a really passionate, provider. So if you have any like advocacy that you wanted to plug or anything like that, I just kind of wanted to give you just the platform to go ahead and share all that.
Oh, well, thank you. Thank you so much. I will start with what would I like to see them do a little bit, if there could be some improvements as a provider. I would say a few different things would be: one, I think keeping it the big companies that are providing insurance for families, having like a designated place, either regionally or state by state, or however you want to tackle that, but to have like people a provider could call, like a Connecticut center for Anthem or for Aetna, where myself could pick up the phone and pull up my EOB and ask a human being a question. Like, why did this get denied? I'm looking at this, I'm sitting with this person, I have their car ID in my hand, their insurance ID in my hand. The numbers are accurate. Why did the last 5 claims get denied? And have someone talk to me at that time, and then, say, we're going to resubmit, we're going to solve it. Because Kim has to do that, and Kim has some phone numbers, but oftentimes you go through this string of people. I don't know where these phone calls are being, where they're located, where the people who are managing the phones are located, and they often don't have any answers for you. So if you get someone on the phone, it's not the right person, or it's not the right department. So I would love for all of the companies to have some sort of system where, as the doctors and the medical providers, we could call and say, hey, I'm looking, can you pull up your system? Here's my name, my license number. here's the date of service, the client's name, what happened, why are you denying these? Like, to speak to someone, that never happens. I have tried, the best one that happened with, I will tell you, is the military TRICARE system,
Okay,
where
that's good.
I
that's a surprise.
I know.
I was happily surprised when there was a problem with, not to say they're submitting, the way you submit to them is simple. It's pretty complicated, but there was some problems with some claims that were getting like falling through the cracks. But when I did call and I went through the provider call line, I actually talked to someone who did that, exactly what I'm saying. She was able to pull up on her computer, see who I was talking to, dates of service, what went wrong, how to resubmit them, give me exactly what to do. It was amazing. I was like, it was a half-hour, extremely productive phone call. So,
I think that's an amazing point. I mean, we didn't even really touch on how hard they are to get a hold of.
They're so hard to get a hold of, and there's no one to get a hold of. Like, sometimes you call some of them, and you're just transferred from phone to phone to phone, and by the time you get to someone, it's a machine. Who knows if anyone listens to any message you leave? It's really complicated. So I would love to have a points of contact where you really can get a person on the phone who this is their job and they know what they're looking at, and they can fix it, or they can tell you what to do to resubmit, how to fix it. That's like that would be unbelievable if that could happen more often. So that's one thing. I think what else? Maybe rate reviews more often, but I don't know who decides that or how they pull statistics of regionally, how much to pay per session code and what level of training you need to get that fee. I find it a little strange, but I don't know who makes those decisions, so that's a little bit like, that would be nice for them to do a more frequent, they should do an annual rate review of the cost of like doing business in Connecticut and like the taxes and all that, and then renew it and fix it and keep up with the times. But they don't, though.
You would think, right?
They don't do that. So that would be another thing. So, but I mean, again, I'm kind of complaining, but I'm complaining, but I still like taking them.
No, I mean, well, exactly. I mean, just because something, I guess, is working to an extent doesn't mean it can't be improved, or doesn't mean that there's not huge errors with it. So I definitely hear where you're coming from.
Yes. So it's like a necessary evil, kind of. As far as advocacy, right now, like I don't know. I wasn't expecting that question. I can't think of anything.
Oh, no worries.
I don't have anything like off the cuff to think about for that, other than, if people, I just say, if you have any friends or family or anyone that you even have like a sense that is just not doing well, to just encourage them to try to reach out for help. And that can be in so many different formats. Now with one thing I can say that COVID helped with, even though it was horrible, was giving people access to like doing virtual meetings, that had always been something we had asked about as providers before, not because we wanted to do virtual meetings, because most providers really prefer in person, including myself, but it was because virtual sometimes is convenient. Like if someone is sick, so they don't want to come into the office because they have like a really bad cold, and they don't feel good, or they broke their leg, so they're in bed, but they want to talk to you. But you can't, they wouldn't reimburse for telehealth, was not a thing before COVID. So COVID really launched that, because insurance companies were forced to say, people aren't leaving their houses, but they still need mental health services. So they started allowing telehealth, which was a big step forward. It's wonderful. I would say for advocacy, now that that's accessible and people have different, the ability to even connect online with people if they can't get to someone in person, there's more access in that way. I think that part's been really good, and just to encourage people to get the help they need, because mental health to me is sometimes it's this very sort of slow decline for people. It's not like they suddenly feel they're in some sort of major depression or even having some sort of major mental health thing. It creeps in slowly, and the person, over the course of maybe, weeks to months, and they start noticing they don't feel so good. But it's this insidious process, and people sometimes don't notice. Like, people in their lives may not notice. It may take months for someone to really be at a low point. So I would say, like, there is, so much that can be done with treatment, both therapy, if medication's indicated, medication, and different options for them. But they have to have, the door open. They have to know to go get the help, or be encouraged, if they've never seen a therapist or a psychologist before, that it's okay. Like, you can feel better. You can get your life back on track. Like, this isn't how you're going to feel the rest of your life, but you have to get help,
Yeah.
Absolutely. I think that's an amazing point. And I mean, just what you just said, your last sentence, I think, just connecting that to, telehealth or teletherapy, I think that teletherapy might be something that might make people more comfortable in getting, initially access to mental health services.
Definitely.
So I think that's awesome.
It is.
And I'm glad that
huge.
I'm glad that these companies have taken that initiative and are now providing that service and reimbursing for it. That's great.
That was probably the biggest step forward since I've been in practice. Period. That I've seen is that them approving.
Period. No, I'm just kidding.
Them approving telehealth and allowing that to be reimbursed. That was a huge step forward. So yeah. So anyways, but thank you again so much for inviting me to come on. This was really fun, and I hope it was enlightening a little bit in some ways.
It really was. Yeah. We appreciate it so much.
Yeah, no, this honestly was like a million times better than whatever was in my head. So I thank you so much for coming and do this. Like you know what I mean, like, and this is just like one tiny facet of your job. Like it's not even like we haven't even talked about your actual job. It's like just letting to do your job, you know what I mean?
Absolutely. I'm like, hey, when do you want to come back?
Right, that's I'm sure like I can literally have you here every day, and we can go over something, and you can pretty much teach us everything about the field of psychology and mental health, like, and we would be for the better for it, 100%.
Thank you so much. Thank you, Nav and Annette. I had a really fun time, and I'm glad you enjoyed it too. And anytime, yes, I'd be happy to come back. I can talk to my billing manager, see if she'd ever be comfortable. She's a little bit shy, but I can talk to her and tell her it was great.
Yeah, we're harmless. It was.
I'll definitely see it what she says, but and I can come back at some point and circle back, and if you have any more topics you want me to review or anything.
For sure. Maybe we could actually talk about actual mental health, you know what I mean? So
yes,
one of those topics. And we're gonna put this on YouTube, so maybe she can see like how not scary we are. So
yes,
and Annette was more nervous about you than anything else.
I was a little nervous at the beginning.
Oh my gosh, don't be nervous, Annette. I had a great time. I've heard so many wonderful things about you, so I thought this went.
Listen, do you take her insurance? Because she definitely needs some help. No, I'm just kidding. No, thank you for coming.
Of course. Thank you so much for having me, and please keep me posted, and I'd love to check out the link when it's ready to be posted.
No, for sure.
Okay.
Absolutely.
All right. Well, have a wonderful rest of your week, and thanks for having me, and I'm sure we'll check back in at some point.
All right. Bye.
Okay.
Thank
all right.
you.
Bye-bye. Thank you. Bye.
All right. So I have a few thoughts. I have actually more than a few thoughts. Do you want me to go first? Actually, you know what? Go ahead. How did you?
No, go for it.
How did you? I was good today. Please. Was I not?
You were good.
All right. Okay. All right. So, I think it kind of occurred to me while Robin was talking. I feel like we should put like a disclaimer here. Even though we've kind of shitted on the insurance companies and how difficult it is um, for mental health providers, and in my eyes, from everything she said, it I feel like it's designed by the insurance companies to make it difficult. You know what I mean? So they can
Mm-hmm.
deny more claims, or just not even uh, just have these therapists and these people just themselves leave, right? And they can go, that's who we have. We pay for these services. They just don't want to accept them. Kind of do that. Whereas they make them go through this entire ringer. We've talked about that, but please, whoever listens to this, I humbly request that if you ever feel that you need any sort of help, please don't take this episode and think like, oh, well, it's already going to be so difficult. No, reach out. Please reach out to anybody there. Telehealth, like Robin was mentioning, is a thing. There's so many places, so many government institutions, private institutions. Please reach out. Somebody will definitely help you. And we don't claim to be any kind of experts, but please reach out to us. Leave a comment on our videos. And you completely anonymous. I don't know you. We don't. You know what I mean. We'll try to get you the resources or anything. If you need help,
Absolutely.
I'm willing to help. But please reach out to an actual professional, not a guy sitting in his room in Connecticut. I would love to help, but there's only so much limit to my help. But please, if you feel the need to reach out. So that was my first thing. I really want to get that across.
Yeah, and the point of this whole, and I'm sorry, I don't mean to cut you off, but the point of conversations like this is because we want these systems to get better.
Yeah.
Not because we want to say these are terrible, never go anywhere near it.
Yeah.
It's not that black and white. It's a nuanced thing because we have to survive, we have to live, we have to thrive in the society that we have.
Yeah.
And this is the society that we have.
Yeah.
If you have insurance, use it. Sometimes these things might come up and it's difficult, but that doesn't mean that it's not worth it because you need, whatever care you're seeking, you need it and it's going to make you better in the long run. But that being said, like I said, that once you start engaging and once you do that, it's fully, it's almost like a responsibility too to say, hey, I'm engaging in this system and here's how I think it can be better. And having conversations like that is what makes healthcare, health insurance, and a whole bunch of other different parts of our society better.
Yeah.
It's because people are willing to talk about it.
No, and again, and a lot of people, and especially men, and I want to speak to men because I feel like women in general are better at taking care of themselves.
I'll let you talk about the men without interrupting.
Yeah, because we know you hate men.
No.
No, but I want to know because there is the stigma, right? Like, oh, I'm a man, I don't need help. Like, think about it this way, right? Like a tiny little cut can turn into something bad. It can get infected, it can grow, it can fester, and you can lose a hand over it, right? So even if it's just like, I'm not saying you had a rough day at work, your boss like yelled at you, you got to go to a fucking therapist. That's not what we're talking about here. We're talking about if there's something that's been bugging you for you repeatedly and you feel like you can't let it go, but you feel like it's a small thing, and I'm guilty of it, and I know a lot of men are guilty of it. They just fucking take the thing, they bury it deep down inside. They don't talk to anybody. Like, talk to a friend, talk to anybody, talk to a stranger. Just like just get it out. And if it still doesn't go away, please, like, reach out to a person because it can grow into something bigger. Not to turn like super dark, but just the New Orleans attack a couple days ago. This guy, and it is an epidemic. I will say this guy felt isolated, felt rejected by both his marriages failing, children not talking to him, and he reached out to an insane organization, that led him down this path of hurting other people. And I know majority of the men out there, they don't want to hurt anybody. People don't want to hurt people. You know what I mean? Like, I'm talking about normal people we're talking about. So but it can be this one little cut can grow into having your arms cut off. So why don't we just fix the cut, right? And before you become radicalized, before you turn into a incel, you know what I mean? Like, let's just nip it at the bud. You're having a tough time. There's nothing wrong with that. There's absolutely nothing wrong with that. Men do need help, and a lot of times, sometimes you just have to take the first step, right? It's not all on you, but we gotta reach. We gotta reach. So please, if you ever feel like you need any kind of help, don't think nobody's gonna care, man. Like nobody's gonna like, if somebody makes fun of you, it says more about them than it does to you. Um, I talk to Robin weekly. We have a conversation. Nothing wrong with me, but I feel better. Like I have a conversation with her, and like she listens to me. Somebody that just listens to me, that's a professional. And then we just have, it's like just talking to a friend. It's literally just like that. She gives me advice. She asks me how I'm doing, and then hey, have a good night. It's just simple as that. I never, and I openly admit it. You know what I mean? Like it's nothing to shy away from. It's nothing crazy. My personal belief is, right out of high school, everybody should have their own personal therapist on phone. You know what I mean? You should be able to call, like, hey, I'm having a tough time. I just need somebody to talk to. Like, hey, can you explain what's happening here? So if you feel like you got a paper cut, please reach out to somebody that'll help. Don't let it lose an arm. That's it for me. Actually, no. What? I have one more thing. And it's a funny thing. And the fact that she said the military insurance was the best one to like get it out of it. It just goes to show. That the government sometimes isn't all bad. So any Canadians listening out there, please, you don't want to go through what she's going through. Please, you don't want that. You don't want the taste of American freedom. That American freedom. The other American freedom's great.
I'll say that the Canadians are like, no, we don't want that at all.
No, please. No, I'm sure there's some Canadians out there that going like, I need a little bit of balding in my life. Please.
I'm sure please. Up there.
Don't find oil in your land. America, you don't want this. You don't want it.
Do you have a media that you want to highlight?
I don't.
A book?
I don't.
Oh, okay. I have ProPublica.
Okay.
So we love ProPublica.
We do.
But I've never I don't think I've ever really mentioned it on this podcast, but so for those who aren't familiar, ProPublica is like it's a news platform, but it's fully like publicly funded, like fully through like donations and stuff like that. So you don't really have to worry about like I guess, certain biases. I mean, obviously everything is going to have some sort of bias. Whatever the author's biases are, they might show up in there, but you don't have some corporate interests like that owns this medium, like like the Washington Post or that sort of stuff. But so I read a ProPublica, and just a disclaimer, a lot of their articles are extremely long, but they put so much effort and time. Like by the time like they write and publish an article, like they have put months to years of research into these articles. Yeah. So they are long, but they're absolutely worth sitting down, taking the time to focus and read on every single word, because they are such compelling stories.
Yes.
But the one that I wanted to highlight, the title of the article, so this is relevant, that's why I'm bringing it up today, is insurers continue to rely on doctors whose judgments have been criticized by courts. So what the article focuses on the case of a young girl who was suffering from anorexia, and she needed like an inpatient, like you live there, you eat there, basically 24-hour treatment. So she needed to, have treatment at a facility. And I mean, there was her personal doctor, like there was mountains and mountains and mountains of evidence as to why she needed this. I think the article at one point, she's 15 years old. It said that she weighed like 79 pounds or something like that.
Jesus.
I mean, even at 15 years old, like,
yeah,
you know, a young woman of that age should, you know, be, even if she's shorter or smaller stature, should probably be around like the 100-pound mark at least, you know.
At least,
I mean,
yeah.
a 70, you know, 79 pounds is extremely thin. And we get some, the article goes into some just insight from her herself. She's saying that she, you know, she's sneaking workouts from her family. Like, so it's kind of like an orthorexia component as well. She's like getting up in the middle of the night to go for runs. You know, she's telling her family that she's eaten when she hasn't. You know, she does like the, oh, I had a big lunch thing, all this sort of stuff, you know, that her family's reporting, that she's reporting herself, that her doctor's reporting. But the insurance company is still saying, you know, like, oh, no, she can probably just do outpatient and she'll be fine. Which, like, the difference in that is huge. Like, she, like, when you're outpatient, it's kind of like what Robin does is outpatient therapy. Like, people go to her.
Yes. But she's not monitoring.
They leave.
Yeah.
Right. She's not constantly monitoring. I mean, there are more intensive, like, there's intensive outpatient services where you go every day.
Yeah.
But there's still a period of time where you're not getting services and they're not able to monitor every meal. They're not giving you exactly the caloric need, you know, substance that you need to recover. They're not giving you the support that you need to recover. So, you know, long story short, the article goes on to talk about basically the doctor, you know, who quote unquote reviewed her case, and then, you know, basically the doctors themselves don't, it's the insurance companies that affirm or deny a claim. The doctors just kind of give insight. So they use these same doctors. They say, here's a snippet of what's going on with this patient. Should we affirm or you know, confirm or deny? And, you know, basically the point of the article is, like, as you can probably tell from the title, is that they're using these same doctors over and over again. And these same doctors are coming up over and over and over again in lawsuits saying, like, you know, so the doctors aren't being directly sued. You can only sue the insurance company. You can't sue the doctor because, again, they didn't actually make a decision. They just kind of gave an opinion. But these doctors are mentioned in these lawsuits. And essentially, like, the judges in these cases are like, why do we keep using this doctor who is clearly either not reviewing these cases thoroughly or just making, like, clearly bad decisions? Like, what is this doing? And there's, like, nothing that can really be done about it. So it's a really interesting read.
Yeah.
So I just kind of wanted to highlight that. It's like a crazy.
No, I'm glad you mentioned that, actually, because I was listening to NPR, and NPR actually did a study as well. A lot of these insurance companies, what they also do is they hire doctors who can't practice anymore because of malpractices lawsuits. So a lot of these people that these doctors go to, as you mentioned, they actually can't go practice medicine anywhere because they've been so bad, because they've been sued so many times. They've actually lost a license. They're still doctors, but they're just really, really, really shitty doctors. But these insurance companies pick them up, and even though it's probably not said anywhere or not outlined anywhere or, like, specifically told to them, there's this underlying thing of, like, the more you deny, the more money you'll probably make, right? And then these doctors obviously are known for bad faith practices, and they kind of go along with it. Shitty, really shitty.
Yeah, I mean, I think the article mentioned, I don't know the exact statistic, but I guess, like, your average, like, doctor that these insurance companies use will deny, like, I think it's like it was like a 60-40 split of what they approve and what
that's
they
an insane
deny.
amount. That's an insane amount.
It is, but it's also, like, that's the average. But, like, some of the doctors that they were utilizing in these cases, it was so much lower. Like, one of the doctors that they, like, specifically say by name, I think her rate was, like, she approved like 20%. Kind of like the AI. Fuck? Like, she was no better than the AI.
No better than the AI. The fucking AI is her. Like, she is an AI. Like, that's just.
It probably is based off of her decisions.
But
right?
you know,
and then she's.
Can I stop you there real quick? like,
Go ahead.
okay, when you say that, like, I just want anybody for no, like, this is a serious thing, right? Like, anybody listening, when she says that she's denied 80% of the cases that come to her, that's 80% of people she's denied, not just some like random like that. When we say,
Right.
like, when we mention these numbers, I want you to like really think, like, these are people behind those cases. These are people like that girl that's 79 fucking pounds. Do you like
Yeah.
do you understand like how light a human being is? You know what I mean? When they're at 79 pounds, like, that's unhealthy. That's unhealthy. That's the people they're denying. So when we say 80% or she's only approving 20%, you gotta picture the people behind those numbers. That's what's really shitty about this.
Yeah, and I mean, in the cross
Sorry, go
examination,
ahead.
it was no, it's fine. In the cross examination, I guess like, because this was the judge that took this, this girl's particular case, and or I'm sorry, this is the doctor that made this decision, or
Mhm.
you know what I mean? Didn't make the
Yes.
decision, but put the
Yes.
input.
Yes.
Like during the cross examination, they were like, "Did you see that she only, weighed 79 pounds, or did you see that, the doctor like?" And she's like, "Oh no, that wasn't included in the file that I
Right.
got." So basically, they get like, I guess whether to as an excuse for these doctors or not, they get like such a pared down like, information on these people that they have to make these decisions on, which is like, it's really not an excuse, because really, like, as a doctor, how are you going to make a decision off of no information?
Yeah, you should know better. Like, hey.
So I mean, it's just a
And
wild system.
you know what it kind of makes me think of? It's kind of maybe makes me think of what just Robin was mentioning, right? Like, they probably like called the doctor that was treating this girl, like, was like, "Hey, we need a report," and the doctor probably goes like, who's gonna read this report, right? Like, this seems like a fucking HIPAA violation. I'm not gonna tell you. You know what I mean? It's probably like all built into this fucking shitty system where the doctor goes like, "I'm not just gonna send you a report about my fucking patient's private medical health report, so just a random person that I don't know." And then like on the other end, like the doctor's getting this like, well, oh, okay, like it's just a basic ass report that I got. Still probably doesn't seem like an insane problem. It just some teenage girl that's just probably having a hard time. Maybe she doesn't need that much of serious care, right? The
Maybe I will
only one
say
person losing is the
yeah.
patient.
Yeah, I mean, I can only speak to it in terms of what like the article that I read said.
Yeah,
I mean, I would say that the article
but it's like
didn't make
it
it
doesn't. It's not a
seem that
hard
way. They
connection.
kind of made it seem like it was like, I definitely agree. I think that could possibly be, a factor, or at least some of it.
Yeah.
But I would say, like, from the article, I got the sense that that's just kind of what they were given by the insurance company. But yeah, we don't really know what was given to the insurance company. So
I think
it could all be kind of, yeah.
I feel like, and whenever me and you have these conversations about like just politics or Congress or in general, I feel like every problem in America can be solved by transparency. Like, just
Yeah.
just having some sort of transparency. Just people being aware of like how shitty some of this health insurance, this politics really is, like all the dirty stuff that goes behind the doors, like
Yeah.
all the money hungry and all this stuff that really happens, and how bad the care is, right? If what I say is true, then you can just imagine like, well, the only really a person at fault here is the insurance company, for hiding stuff from the doctor they themselves are consulting, or hiring even a shitty doctor to begin with, or hiring a doctor that's been sued so often that he can't practice medicine to begin at all ever. But yeah, these insurance companies have no problem hiring that guy just because he's still a doctor, right? But speaking of ProPublica, I actually do have a media recommendation. They're called Zeteo, Zeteo. They kind of do what ProPublica does. They're a little bit of more of like a fast, push it out, like, hey, here, like just the current news. They don't really go too deep into it. They're a little bit of trying to become more mainstream, just to get the uh, uh, information out to you faster. They're not to say that they're not doing their research well, but it's more of just like, get the information out fast. But I do like them. They do seem credible. I don't know if they'll continue to be credible, but so far, they seem to be a source that I seem to have a little bit of trust in. It's Zeteo. They're good.
That's Mehdi Hassan, right?
Yes, Mehdi Hassan. I really like him. I really like him. His focus is on
like
a lot of Palestinian and Israeli conflict right now, but he does cover a vast majority of American politics and world politics to begin with. He's great. He's great. Anything else you want to add?
I think I'm okay. I really enjoyed.
Denied defending the pose, brother. Denied defending the pose. I back the adjust. No, please. Hey, we don't. I'm not trying to get canceled. All the factors is not trying to get canceled.
We're not gonna defend.
Nobody should die.
Vigilante justice.
Nobody should die.
But we definitely understand.
But we definitely understand. But we definitely understand.
Such conversation, I mean, and I think it's ultimately a good thing that people are talking about it, and I hope that we can keep. I know it's already fallen out of the media, but I think it's a conversation that needs to continue.
Oh, I'm sure it'll come back once the lawsuit really gets going. I'm sure that this conversation will come back.
Trial,
so oh, not the lawsuit, trial. Yes.
They're not going to be able to keep that. I mean, they're not going to be able to bury that. People will be lined up outside that court.
Yes. The adjuster is being put to trial. Anyways, no, but we didn't want to have the conversation be built around this. We really wanted to be more about like how does a small practice like Robin's, Dr. Cirillo's, deal with insurance, and you can already imagine like this being multiplied by 1 million times, right? When you take it, how many practices there are, bigger practices, smaller practices, and you can see the scale of the issue here, the problem here. And to go back to not even be joke, like not even being a joke thing, you can see how a person like Luigi Mangione can get to that conclusion after just even hearing about this. Like, hey, this is really messed up, right? Again, not trying to justify any of his actions or alleged actions, but we understand. And I think, and I don't think this is a left versus right, up versus down issue. I think it's just an issue that everybody can see is as clear as black and white, right? Like, hey, you guys are doing something bad. It needs to not happen, right?
Right. I think that's what's important about it.
I really do.
It's an all.
It's not a political issue. Science is not a political issue. In my eyes, science is not political. It's just not. These people dedicate their lives, dedicate their lives to really understand something, and you don't just dismiss them because some guy, I'm not going to say who, but his name rhymes with dump, but just said so.
We're so afraid to use the T word on this.
He who must not be named. The Dark Lord. The Orange Lord. I'm sorry. The Orange Lord. Anyways, thank you guys for joining us on another week of All the Factors. We will be here next week, as always, to talk about what's happening in the world. Maybe a little bit more cheerful topic. I don't know. We'll see what problem we want to tackle.
Okay. What's going to be the date?
I don't know what the date's going to be.
It's not going to be Trump's America yet, but
it's not going to be Trump's America yet. So,
but the 15th.
The 15th.
Well, I'm sure we'll be talking about
something
the week after. Will.
Yes. In America's new chapter will begin afterwards. We will see if we buy Greenland, or we will see if Canada will be the 51st state of the United States. We will see where we go with that. Hot topics. Anyways, no. Honestly, like the purpose of this channel was to kind of learn from you guys as much as to try to bring you guys information and to really be keeping track of what's happening with our government and try to bring that to you a little bit light and have a little bit more transparency. As much as we see, we want to make sure that you guys see. We'll have some sort of topics for you. But we really appreciate it, you guys joining us. We will be on YouTube. and we're working on other social medias as well, TikTok and Instagram and stuff like that. Stay tuned.
Yeah, I mean, we are posting on YouTube. We are just a little behind. So
please,
if there's any that you need to catch up on,
yeah,
feel free to go.
If you missed,
we are at All the Factors
on YouTube.
On YouTube. Yeah,
please go follow us. Please go subscribe to us. Please, if you can like our videos, that would be great. It's All the Factors on YouTube. Thank you so much.